There are many factors that create an attractive face. Eye color and facial traits are genetically determined. However, there are environmental stresses that can change the shape of the face, limiting genetic beauty potential. A pleasing face is both proportional and symmetrical. Formation of the arch and jaw position are together very important factors. They're the foundational scaffolding that supports the overlaying muscles and tissue that create what we identify as beauty. It's common to have distortion occur as a result of mouth breathing. Allergies, enlarged tonsils and adenoids, and deviated septums create problems. Chronic mouth breathing causes the tongue to drop down to the floor of the mouth. The arch formation narrows, and the teeth become crooked and crowded. The upper teeth tilt back, the lower jaw moves back or recedes, compressing the jaw joints. These changes not only cause facial deformities, but also migraines, headaches, neck pain, TMD, and other sleep-breathing disorders. In women especially, symptoms of facial, neck and joint pain, and stuffiness or ringing in the ears result because the muscles are strained, fatigued, and overworked. Over time, these supporting muscles develop painful muscle spasms. As the muscles contract or shorten from spasm, they also change the underlying skeletal structure, leading to an unattractive and/or painful change throughout the body. Forward head posture, like a turtle head, changes to the spine, uneven hips, legs, and feet can become painful and compromise overall function and health. A narrow arch form can force the tongue back into the throat and block the airway, causing snoring, sleep apnea, and other breathing disorders. This affects both children and adults and has severe health consequences and complications. This includes high blood pressure, stroke, insomnia, heartburn, acid reflux, daytime sleepiness, and fatigue, along with diabetes, ADD, ADHD, and bedwetting. The goal is to return the jaw to its normal, healthy, decompressed position. With proper treatment, muscle spasms relax and disappear, allowing the muscles to return to their natural, ideal length. As a result, the jaw returns to a more pleasing position, both physiologically and aesthetically. The treatment for these problems is to create a temporary appliance that's worn over the bottom teeth, usually for a period of about 3 or more months, allowing the jaw to slide forward. The jaw joints decompress as fatigued muscles relax. If the appliance is not worn, the jaw moves back again and the cycle of pain returns with facial compromise of the receding of the jaw position. The treatment choices vary according to the age, pain patterns, and level of complexity of the patient's needs. Typical treatment for an adult with pain patterns would involve the use of an orthotic. If the teeth are in need of structural support, the bite can be reconstructed in porcelain. The natural, beautiful ceramic protects a tooth like a cast protects a broken bone. For younger patients, or those who are blessed with healthy and naturally beautiful teeth, the treatment would follow a more orthopedic and orthodontic plan. For younger patients, or those with healthy tooth structure, the solution is to gently increase the narrow arch with an expandable appliance that gently applies directional tension to all sides of the arch for about 3 or 4 months. By widening the arch, more space is created to accommodate room needed to straighten the teeth. Additionally, it creates the necessary freedom for the tongue to reposition to a more healthy location that does not block the airway. Bonding material is applied to the molars and the backside of the front teeth, holding this desired new position of the jaw without fear of relapse. Braces can now move the teeth into their ideal position. The bonded material is removed, and the newly created bite will hold the proper aesthetic and proper skeletal position in place. Not only has a wonderful, harmonious relationship between the bite and complementary musculature been created, but also more symmetrical facial proportions and better airflow to help correct the breathing disorders as well. This is all accomplished with non-invasive techniques. Externally, the tissues have been gently stretched over the new supporting structures, providing a beautiful facelift effect. Ultimately, the patient's arch form and jaw position have been restored, providing enhanced health and beauty.